Hi, I'm Dan Hoke. I'm the IT director at Emory's Brain Health Center, and we are a cross-departmental center that does everything from neurosurgery to neurology, psychiatry, sleep, and rehab medicine. We have a service line called Deep Brain Stimulation, which is an intervention that really helps with movement disorders and treatment-resistant depression. The image in the bottom right-hand corner kind of depicts how we put leads in the brain, and it's connected to a battery source. We have our movement disorders program really addresses Parkinson's, epilepsy, and similar conditions. Our Parkinson's service line is relatively small, and we started working with Rimidi to come up with a patient journey app. Dan, you just want me to give you a second real quick to introduce yourself? We have two Dans.
My name is Dan Bonistalli. I'm the product director at Rimidi.
And we can go ahead and go to the next line. As I mentioned, DBS crosses multiple departments at Brain Health. There is some motion analysis. There's neurologists involved. From diagnosis to neurosurgery is actually quite a number of steps. And we had providers having trouble tracking patients through the departments in different phases from diagnosis to surgery. And so we developed on old technology, a provider-facing patient tracker within Cerner PowerChart. And this is kind of a mock-up of that. I know it's hard to read, but essentially there's some demographics up front, and then there's like psych sign-off, neuropsych, 3D, different steps that we follow the patients through. Well, we have she's done a lot of app development work in terms of design. Her name's Bona Kim. She said, if our providers have trouble tracking patients through the process, what's it like for patients? Dan, if you'll hit the button real quick. And what we find here is that while we have a bunch of steps laid out, it doesn't really correlate with timing of the patient journey. We tend to group some appointments up front where the patient's actively engaged. And then we go into kind of case review, cross-departmental case conferences. And so there's really some downtime, about 3 months, before we really re-engage the patient with an OR date and next steps for surgery. So we realized we really need to keep patients engaged throughout this time down period where we're discussing internally. And we want to use that for status updates, information regarding next encounters. Sometimes you would have to withhold your movement disorders medication so that we can do a proper analysis. And we really thought it was a way, almost in like an Amazon style tracking mechanism, you know where you are in that process. And so to really improve the patient experience, we reached out to Rimidi to help us design the application. And Dan, if you kind of want to take it from there.
Absolutely. So as I said before, I'm the product director at Rimidi. And at Rimidi, we've been working since 2016 with FHIR and with FHIR apps, primarily on our flagship application. But it put us in a really good position from a tech perspective to help in this capacity and to collaborate with Emory on this application. And we were also in a good location from a location perspective too, being only a few miles away from Emory in Midtown Atlanta. So I'll start off by just going straight into the application. So the DBS CareTrek application is an application with both a patient-facing and provider-facing interface, where the patient-facing interface is both an Android and iOS application. The provider-facing interface is actually a smart on FHIR iframe within Emory's Cerner instance. And we use this iframe within the application in order to register patients with the program and enroll them in the application. And by pre-registering the patients, it allows the app to develop a list of patients who should be part of this program so that we already know who they are on the app side before they even download the application and sign in for the very first time. So here's a larger image of the registration screen, and it does serve a dual purpose here beyond just enrolling patients with the program, but it also provides insight into the patient journey and data that is captured from the patient-facing applications. For example, certain appointments require 24-hour off medication status, and within this window, a practitioner can see that the patient has confirmed or alternatively validated that they had not been off their medication, and so appropriate action can be taken at the clinician side to determine, can we continue with this appointment, and take the necessary actions on that front. On the right-hand column, we have progress status, which is set on the provider-facing side and actually becomes available to the patient on their application. So they remain up to date throughout their process and feel like they have an avenue with which they can stay informed. The application is a patient journey. It is schedule driven, and it is driven primarily through the FHIR appointment resource. So upon login, a patient is taken to the very first step in their journey, which is their psychiatry appointment. The FHIR resource gives the patient the date, time, practitioner, location of the appointment, details about the appointment, and a checklist that the patient can fill out so that they feel and are more informed and ready for their appointment. The user interface allows the patient to go further into the future, see future appointments, and gives them the flexibility to learn at their own pace, as well as investigate what's next in their journey and see the whole journey in one place. A few checklists actually do feedback to the provider-facing view, such as, have I stopped taking my medications for 12 hours before appointment and 24 hours for longer acting medications. Processing information also feeds back into the patient-facing view, which is driven from the provider-facing portal. The scheduling-driven experience that the patient has is more than just the journey, but it also includes resources like YouTube videos, Emory videos, device manuals that are tied specifically to appointments that the patient either has or will be attending. For example, a neurosurgery visit would prompt the neurosurgery video to automatically and dynamically populate my library so that a patient has a list of resources that they can consult at any time.
Oh, yep, we're down to 5 minutes.
From appointments, which allow the patient to see who they can contact if they need any help. We have leveraged authorization and authentication via the EMR using OAuth2 and OIDC support. And the provider-facing side is entirely smart on FHIR, so no need for the provider to enter any credentials. It's a seamless experience. Part of our tech strategy in developing a FHIR application in this capacity is to leverage FHIR data, but then augment it with two different types of tables in our application database, config tables and supplementary tables, where config tables help qualify appointment types that are part of the DBS program, so that patients with with additional appointments that aren't necessarily related, those appointments are ignored. And then supplementary data like provider photos, as well as supplementary data like lat and long of locations, so that we can have integration with maps. And then finally, there is a need, because not everyone's going to download an application, for some of the more important features to be available outside of an app. So the DBS CareTrek application also allows for two-way SMS messaging, so that people who maybe didn't download an app or have a flip phone, for example, are still thought of and taken care of in this program. So to sum up on the application and the technical approach, you got to pay attention to details early on, as not every resource is supported at every EMR or even in every client environment. Leveraging EHR authentication authorization is always a smart decision. It takes some burden off of you as a developer, and it's mostly, and I would not imagine a situation where it wouldn't be safer and easier. A unified application serves two distinct experiences, and merging EHR FHIR data with configuration settings allow the DBS CareTrek application to be more than just an application based off of FHIR alone, in that we can customize some experiences and make it specific to the use case. And then finally, meeting patients where they are. Not all patients will use the app, but we do have to reach them. And we believe that this application has been able to do that. And that is the end of my presentation. Thank you for listening.